Sexual dysfunction. Are you sexually frustrated? Stay tuned. Welcome to my channel. This is Alema Health Matters. Is this your first time? I urge you to subscribe to my channel, like this video, and also share. You can also comment on the comment section, seek any clarification, or ask a question. And don't forget to hit the notification button so that you will be notified every time I post a new video. This episode objectives, we have 5 objectives, which are: what is a sexual dysfunction or a sexual disorder? Erectile disorder in men, male premature or early ejaculation and treatment, male orgasmic disorder and treatment, female orgasmic disorder and treatment. Those are our 5 objectives that we will measure our discussions on. What is a sexual dysfunction? Sexual dysfunction refers to the difficult experienced to one or all the 4 stages of normal sexual activity. The 4 stages of normal sexual activity are: number 1, desire phase, whereby there is desire to participate in a sexual activity. The second stage is excitement phase, where there is initial arousal, and in this stage there is combination of psychological sense of sexual pleasure, whereby there is erection in men, and in women it's vaginal expansion and lubrication. The third stage is orgasm phase, and this is the peak of sexual activity. Then the fourth stage is the resolution phase. After orgasm, muscular relaxation, males have a refractory period during where further erection and orgasm is not possible, but women are capable of additional stimulation and multiple orgasm. What is an erectile disorder? Erectile disorder is a recurrent inability to attain or maintain adequate erection until completion of the sexual activity. Erections begin with a sexual signal or a stimuli such as partner's touch, and men may report the inability to erect from the beginning of a sexual activity, while others experience an erection that is not maintained at penetration. Others may lose the erection during sexual intercourse, and others can only erect upon awakening or during self-masturbation. Let's have a look now at male premature or early ejaculation. Premature ejaculation, it is the persistent or recurrent ejaculation with minimal sexual stimulation before, on, or shortly after penetration and before the person wishes it. Treatment options for premature ejaculation include the squeeze technique, which is the most common by Mayo Clinic ND, whereby the couple begins sexual activity as usual, including stimulation of the penis until the male with early ejaculation feels the urge to ejaculate. Then the partner squeezes the end of the penis at the point where the head joins the shaft and maintain the squeeze for several seconds until the urge to ejaculate passes. After the squeeze is released, the couple is instructed to wait for about 30 seconds, then go back to foreplay. Repeat the squeeze process, and by repeating this process as necessary, the male can generally engage in sexual intercourse, ejaculation, followed by a ejaculation, then a resolution characterized by feelings of well-being and muscular relaxation. And therefore, male orgasmic disorder involves recurrent inability to achieve orgasm despite lengthy sexual activity. Treatment options. The standard treatment for orgasmic disorder involves eliminating performance anxiety and ensuring adequate levels of physical stimulation. Similar to the squeeze technique, the couple is advised to caress the penis manually or orally until erection is attained, but cease stimulation when arousal approaches the point of orgasm. This reduces performance anxiety and allows the man to enjoy the sexual pleasure provided by the touching. The goal is to allow the man to reach orgasm. Now let's have a look on the female orgasmic disorder. But let's first understand the female sexual response and orgasm. When a woman is sexually excited, there is a surge of fluid into the vagina, which provides lubrication before and during intercourse. As the woman receives more sexual stimulation, either by direct pressure on the clitoris or as pressure on the walls of the vagina and cervix, tension builds up, and when tension is released, pleasurable rhythmic contractions of the uterus and the vagina occur. This release is called an orgasm. That's how a woman achieves her orgasm. And therefore, a female orgasmic disorder, it is the recurrent inability of a woman to have an orgasm after an adequate sexual arousal and sexual stimulation. Treatment options, we have Kegel exercise, whereby there is a contraction of the pelvic floor. It is used to strengthen vaginal muscles, and it also helps to increase muscle tone, improve orgasmic intensity, provide distraction during intercourse, and improve awareness of sexual response. That is our end of discussion in this episode. I urge you to subscribe to my channel. Continue watching my videos. We have more exciting videos. Like this video and also share so that you can also create awareness about the various conditions that we are discussing in this channel. Thank you so much for watching and staying tuned.